Welcome to the Rochester City School District Blood-Borne Pathogen Training. In today's session, you'll be learning about what blood-borne pathogens are, how infection could occur, especially from exposure incidents, universal precautions, prevention of exposure incidents, exposure incident procedures. What are blood-borne pathogens? Blood-borne pathogens are pathogenic microorganisms that are present in human blood and can cause disease to humans. Examples include HIV, hepatitis B, and AIDS. Why are we concerned about blood-borne pathogens? Accidental contact with contaminated blood can infect a person who is providing first aid or who is cleaning up a spill of blood or other bodily fluid. For an infection to occur, one of the following must also occur. The infected blood or other fluid contacts broken skin, for example, a cut, rash, abrasion, or the infected blood or other fluid contacts a mucous membrane, for example, eye, nose, or mouth. Either event is called an exposure incident. What is our exposure potential? In our district, there is a potential that you would be exposed to blood or other bodily fluid in the following ways. Caring for an ill or injured person who is experiencing bleeding or loss of another bodily fluid. For example, a staff member or a student could come to you and ask for a Band-Aid because they've injured a finger. During a cleanup incident following an injury or illness in which bleeding or loss of another bodily fluid occurred. For example, a student may have had an accident. What are universal precautions? We cannot tell by looking at any individual if he or she is infected with a blood-borne pathogen. Because we do not know if an individual is infected, we treat all blood and other bodily fluids as if they are known to be infected. This approach is called universal precautions. We always wear the required personal protective equipment, or PPE, and take the appropriate cleaning and sanitation steps to prevent exposure to ourselves and to others. Remember, any blood or bodily fluid should be treated as if it's contaminated. Examples include of bodily fluids: spit, sweat, urine, feces, and vomit. How do we prevent exposure incidents? Always wear the required level of personal protective equipment, or PPE, when responding. Clean and sanitize any surfaces that were in contact with blood or other bodily fluid. Remove PPE carefully and discard. Wash your hands immediately with large quantities of soap and warm water. All persons trained and authorized to respond to incidents are eligible to receive the hepatitis B vaccine. If you believe that you are eligible, please see your supervisor or principal for more information. What are types of personnel protective equipment? Safety glasses with side shields. Safety glasses are required for all blood-borne pathogen response. Face shields are used if blood or other fluids could splash, spray, or become airborne. Disposable gloves are required for all blood-borne pathogen response. Double gloving is always recommended. Apron, disposable suit, and shoe covers are used if blood or other fluid could splash, spray, or become airborne, or otherwise come in contact with feet or the body. Barrier mask, bag valve mask for CPR or mouth-to-mouth, nose, or stoma breathing. If someone were to come to you and ask for a Band-Aid because they've cut their finger, you are not required to put on safety glasses, apron, disposable suit in order to provide the Band-Aid, but it is recommended that you put on disposable gloves. How do we clean up and sanitize our area? Remember, wear all required personnel protective equipment. Treat all spills, bandages, etc. with the sanitizing solution used by our district. Any material that has the potential to liberate liquid, blood, and/or dust when dried should be placed in a red biohazard bag, and the bag should be rebagged or double bagged. Wipe up the surfaces that were in contact with the spill using the sanitizer. In the event that you do not have a red biohazard bag, you can use a regular bag, such as a Wegmans bag. Make sure that you double bag it, tie it with a knot, mark it that it's a biohazard, and then put it in the dumpster. What do we do if we are exposed? If another person's blood or bodily fluid contacts your skin or mucous membranes, such as your eyes, nose, or mouth, follow these steps. Wash skin with large amounts of soap and water for 20 minutes. Yes, I said 20 minutes. Flush mucous membranes with large quantities of warm water. Report the incident to your supervisor or program administrator and complete the district's exposure form. You can get a copy of the district's exposure form from your supervisor or program administrator. You will be provided with follow-up confidential care, which is paid for by our district. It can take up to 10 years for HIV to show up in your system. You may need to be tested if you've had a substantial exposure. As we conclude this training, remember, unprotected contact with blood, contaminated with blood-borne pathogens, can transmit the disease through contact with broken skin, eyes, nose, or mouth. Observe universal precautions. Always treat blood and other bodily fluid as if it were known to be contaminated by blood-borne pathogens. Wear the necessary personal protective equipment. Clean and sanitize any spill area with sanitizer. Report any suspected exposure incident. Contact your supervisor immediately if you require additional assistance. Needle sticks and direct contact from infected persons to broken skin are prevalent modes of transmission. If you have an open wound, cut, or scrape, cover it up before you come to work. Don't forget, wear your gloves, especially if you need to assist someone. If they are able to assist themselves, give the person directions. For example, you could direct a person with a bloody nose to lean forward and pinch their nose, instead of you doing it for them. Hand them tissues and stand by to offer additional assistance as necessary. Thank you for joining us for Blood-Borne Pathogens training. For more information regarding blood-borne pathogens or other safety issues, please contact your building administrator or department supervisor. Or you can contact Suzanne Wheatcraft, Director of School Environmental Safety, 336-4005, or contact Lisa Berkovich, Emergency Management and Professional Development Coordinator, at 262-8650, or contact Christopher Hotch, Director of Risk Management, at 262-8320.